Very interesting press release came out this morning on the show on the next slide. I just did this not too long ago. Ensure that your company, that you're being taken care of and take full advantage of all the technology tools made available behind the tracking. That's what Mr. McLeod talked about this morning. Tracking the performance of that driver and your employees that conduct safety and compliance work for your company. We talked about that a couple of slides back. Everybody has to have buy-in on what's happening to protect the company and make sure that their employment stays stable. What do you mean he isn't a doctor? Or we didn't make our 382 protocol for the accident? And how did this attorney get my home phone number informing me that the driver had a poor performance record with roadside inspections for this other company? Not the kind of words you want to hear your safety or dispatch personnel tell you on Monday morning following an accident or injury. Again, we live it every day in our company. We have people that call us after they're in trouble. Just this morning, the press release was issued by the USDOT informing the world that an owner of a drug testing company had been acting as an MRO, medical review officer. He was sentenced to prison. But I read right through that. The first thing going through my mind is, look at the future legal issues that whoever was using that company faces. Because the DA is going to say, that's null and void. So that's the bigger issue. The number one enforcement penalty assessment released by us from CSA in August, you need to take a drive to it, take a look at it, was the lack of follow-through on implementing the drug and alcohol testing program. I meet a lot of companies that don't want to talk about it, they really don't understand it. My service provider is doing that. They're coming after you, they're not coming after me. You can just buy me as a supplier, but they're coming after you. So know who you're dealing with. There's lots of good providers out there, but make sure they've got credentials. Okay? We dealt with a major chain. I can't release the name, but I'll tell you this. We get certified copies of physician's medical license. That's the best we can do. And there was a major fatality here some years back where a carrier and us thought the medical license was fine. Until 2 years later there was a fatality. And the attorney went back to subpoena the records and the MD license had been expired 6 months. Nothing I can do about it. Nothing my customers can do anything about it. But that thing's going to court pretty soon. It's a little scary. But do what you can to make sure you, the provider or yourself, if it's in-house, can validate the best you can of who you're doing business with.